Johns Hopkins researchers just came up with a massive study to show that people have an emotional connection to their heart health, and they've discovered something they call broken heart syndrome, where people will actually have what looks like a heart attack. Well, of course we know this is related to adrenaline. How can you control adrenaline in your body? Well, a horrible thing happens. You want to be in a position where your response will be appropriate and you won't have what looks like a heart attack or some horrible event happen in your body. That's not hard to do. First of all, we want to keep your diet proper. So you don't want to eat a lot of sugar because that causes adrenal stress. You always want to have a little protein with every meal. In our fast-paced society, it's really common for people to take like a complete carbohydrate meal, and that's all. A bun or a muffin or a chunk of bread, and that's it. That's not good. That makes your blood sugar rise real fast and drop real fast. It acts a lot like plain old sugar, so you want to avoid that. In addition to that, you always want to have a little bit of protein. Protein's expensive, so cheap food generally doesn't have a lot of protein in it, so it's your job to have nuts, seeds, or possibly a little cheese, and if it's refrigeration's handy, some meat, some chicken or beef or a little bit of wild game, something like that. And you do that every 4 to 6 hours to balance adrenal function. And the drug that's the most effective for adrenal treatment is drug X, exercise. So when you exercise, what happens is that your body does two things. It makes endorphins, which is your body's own relaxing chemicals like morphine, but they're totally safe, somewhat addictive, but in a good way, and your body will also use up some of that adrenaline so that you don't have excess reserves, so that when you're under stress, you make this adrenaline happen. It squeezes your heart and squeezes your blood vessels, and you wind up with a serious problem that's broken heart syndrome, either the full-blown deal where you pass out and look like you have a heart attack, or you just have a heartache. You don't feel good, and you don't feel good all the time. So taking care of your adrenal gland is really something that you can do well. Exercise, eat right, avoid sugar, and always get with your doctor because we're better together.